everyone. I'm Laura with Kansas City Mom Collective, and today I'm chatting with Dr. Jason Brown. He is an ENT at Children's Mercy. This time of year presents a lot of illnesses in children, and that can lead to ear infections, which a lot of parents wonder when is it time to seek ear tube procedures. So we are here with Dr. Jason Brown with frequently asked questions on ear infections and ear tubes, and we're just glad to have you.
Well, it's a pleasure to be here, and thanks for making the time and taking the time to discuss this topic. I think it's far and away one of the most common things that we see and do, and across the United States, somewhere between, depending on what you read, between 500,000 and a million kids undergo ear tubes every year. So it's a very common procedure, and then there's also a lot of questions that we get, and maybe some misunderstandings and misgivings about their roles in your child's health. So happy to be a part and happy to help today.
Yeah. So let's just start at the basics. What are ear tubes and why might a child need them?
Yeah, so ear tubes are little tiny tubes, and sometimes there's a misgiving that you might see them sticking out of the ear or something along those lines. Not the case. I get that question quite a bit, actually. But they sit flush with the eardrum, and their whole role is to regulate pressure between the outside world and the middle ear space. So kids can get recurrent ear infections or a buildup of fluid that persists for a period of time, and the resulting consequences of those are oftentimes what lead us down the path to ear tubes. So um, suffice it to say that they're tiny plastic tubes, somewhere in the realm of 1 to 2 millimeters in diameter, so teeny tiny, that rest within the eardrum itself and can help with mitigating, preventing, or changing the course of ongoing ear infections, or helping to eliminate fluid to help with hearing. Those are our two most common reasons that we see kids for ear tubes.
Okay. So how can a parent know when it's time to consider ear tubes for their child?
Sure. So ear tubes, the most common criteria that we see is the infectious criteria. And that's 3 infections within 6 months or 4 infections in a year are kind of the criteria that are outlined by the American Academy of Otolaryngology. That's the hard word to say for ENT, and or the American Academy of Pediatrics. They kind of share the same guidelines. So 3 infections in 6 months or 4 in a year. There's also other special circumstances. Children with cleft palate a lot of time will have difficulty with their eustachian tubes, which is the natural tube that connects the ear to the back of the nose. And when that palate isn't intact, the muscular sling that helps open and close those eustachian tubes doesn't work. So cleft palate children a lot of times need ear tubes to help regulate that pressure in their ear. And then lastly, if we have persistent fluid in the ears for a few months, 3 months or longer, and we have an associated documented hearing loss, or we're having vestibular or dizziness or off balance symptoms, can also be indications for ear tubes.
Okay. So walk me through the parent has decided with you and the other ENTs that it's time to do ear tubes. What does that procedure involve? And what should they expect the day of?
Sure. So here at Children's, I can speak to that experience.
Sure.
It's a procedure that's done outpatient in the operating room. So your child would come into the preoperative area at Children's Mercy, and they would meet with the surgical team, the surgeon that's performing the procedure, as well as the anesthesiologist, the nursing staff, and the operating room staff. And then once everybody's done their assessment and is ready to go, we'd head back to the operating room. Your child would go to sleep with a little mask with the anesthesiologist. And depending upon the age of the child, depending upon any medical comorbidities that they may have, sometimes once your child's asleep, the anesthesiologist would start an IV as well, just for some added medical security. But for some of our other healthy younger children, oftentimes they don't get that IV. And then we would look underneath the microscope at the ears, clean out any wax that's in the way, make a teeny tiny little incision in the eardrum, and suction out any fluid or infection or pus that may be there that day, and then pop in that little tiny tube that we had alluded to earlier. And that whole procedure for both sides takes less than 5 minutes. So it doesn't take very long. Your child's not under anesthesia for a very long period of time. And then from there, your child would go to the recovery room where they would hang out for about 30 minutes or so while they wake up. And then you'll be reunited with your child. And then making sure we're eating and drinking and all of those kinds of things and that we're comfortable and not having a lot of pain afterwards, we'd get you home. Um, this procedure typically does not have a lot of pain associated with it. Most children are acting themselves by later the same day, meaning they're bouncing off the walls, and any respite you may have thought you may have had on a day of surgery where
Yeah.
your kid may be kind of down and out for a little bit, I think is going to be I think you'll be a little disappointed. They'll be ready to go later that afternoon or the next day. So it's a pretty quick throughput procedure.
Okay. One question that has
Mhm.
come up in my mind, what age do you see for ear tubes?
Yeah, I think the most common age group that we see is between 1 and 3 years of age, but
Okay.
certainly between 1 and 2, I would, 12 and 24 months of age, far and away the most common age group that we see.
Okay. So sounds like, the recovery process is fairly simple in terms of surgeries, right? But
Mhm.
with any surgery, there sometimes can be risks. What
Sure.
are some of the risks or side effects parents should be aware
Excuse me. So the biggest risk that we see is a little bit of drainage from the ears afterwards that can sometimes be a little bit gross and can kind of get, on your clothes or on your child's, kind of dry on your child's cheek or face. And that's just from some of the leftover fluid that maybe has come out of the ear and has dried there. Typically, the risk in the immediate post-operative period is very low. So it's a super safe procedure. You may have a little bit of blood tinged drainage for the first day or two because we do make a small incision in the eardrum, so that's not uncommon. Um, but as far as, changes in hearing, where, a lot of times the goal is to make the hearing better. So that's usually not much of a risk. Where some of the risk lies is down the road with ear tubes. So the ear tubes that we most typically use, at least for the first go around, are designed to last on the order of about 12 to 18 months before they fall out of your child's ear. So if we're going on about 3 years or so and those tubes have been in place, they haven't fallen out, we haven't had any issues with the tubes themselves, our ears have been healthy, sometimes we physically take them out at that point, but I would say that's less than 10% of cases. So, of the most common complications, if we want to call that a complication, is retained tubes, right? We just need to take them out later. Very, very, very rarely do we have an instance where the tube either falls out or doesn't fall out and gets trapped with some healing skin or eardrum around it, and that's called a cholesteatoma. And sometimes that can be a problem with an ongoing draining ear. Um, Again, those are very uncommon, probably less than 0.1% of kids that get ear tubes. So that's probably at the the bad end of the spectrum. But the more common things that we see during that time frame of tubes being in is drainage from the ears, because then the tubes are doing their job. That means that, instead of if your child gets an ear infection, that ear infection isn't, building up behind the eardrum, but instead has a route of egress, right? And sometimes, that can be a recurrent problem. We get what's called chronic otorrhea or recurrent otorrhea. And that can sometimes be kind of a bugaboo to treat. And we typically treat that with ototopical ear drops, so antibiotic ear drops, wicking techniques, drying techniques to try and keep those ears nice and dry. That kind of leads to the next point, which is it necessary to avoid water or keep your ears dry while your tubes are in place? Well, previously, we would say yes, but the bulk of the new literature over the course of the last few years suggests that that may not be the case. So, oftentimes, we'll still recommend ear tube, or excuse me, earplug use in children with ear tubes in dirty water sources. So, if you're going on vacation to the beach, or you're going to the lake, or something like that, where the water is going to be kind of gross, or suspect at the very least,
of?
sometimes we recommend it. But I also tell my patients that the data doesn't necessarily support that it will prevent your child from getting like an ear infection with the ear tube in place because we're trying to occlude the ear. With that said, things like swimming pools or the bathtub, we typically don't recommend any ear water protection from that because those tend to be generally pretty clean water sources. So suffice it to say, that's a very long-winded answer, right? But suffice it to say that the most common things that we see post-operatively and then while tubes are in place is recurrent drainage from the ear, and that can be pus. If there's an infection, it can be fluid. Sometimes, and it can be a little bit disconcerting, but blood can sometimes come. And when we see that, that's usually an indication that there's an infection with some granulation tissue or some healing tissue around the ear tube that is really easy to get infected. So if your child has ear tubes in place and you see blood from the ears, don't panic. It usually just means that there's a little bit of healing tissue around the tube, and we just need to treat that with some antibiotics and or steroid drops.
Okay. So an easy fix at least.
Yeah,
Okay. So how do the ear tubes impact a child's hearing, speech development, and overall comfort?
that's a great question. So, and I think that question stems from what is the cause and the need for ear tubes? So if your child is coming in to see us and there's a bunch of fluid in the ear and it hasn't resolved, then what we'll do is we'll oftentimes get a hearing test before your child gets ear tubes. And if we have a documented conductive hearing loss at that point in time, we would then place the tubes, drain the fluid, and then get a hearing test postoperatively with the anticipation that that hearing should get better afterwards. Now, that leads to the speech component, which is if we have chronic fluid in our ears and we're not hearing things correctly, you can imagine walking through life with your fingers in
Right.
your ear. You're not hearing things correctly, and therefore your speech isn't developing properly as well. And I will say, just anecdotally, I get a lot of parents that tell me, like, oh my gosh, after we put these tubes in, my kid won't shut up. They're just talking all the time. And, that makes me feel good that we've
Sure.
done something good for this child, and they're kind of on their way with life. My goal is to play a very, very small role in your kid's life. Like if I can just do this one thing to help get them over the hump, and we never have to see each other again, we're
Right.
doing great. And then as far as overall comfort is concerned, your child should not feel the ear tubes sitting in their eardrum. Okay. Sometimes kids will complain that, like, ah, man, they feel something down there. And if we'll look in the ear, there might be some crusting or some wax that sometimes builds up around the tube. And that kind of pulls on the eardrum a little bit. So every once in a while, every once in a blue moon, I'll have a child complaining that they feel something down there. And it's usually not in the immediate postoperative period. It's after it's been in for several months or years that that complaint kind of pops up. But overall, ear tubes aren't uncomfortable. They typically don't feel them in there. And as far as their overall comfort, if we no longer have fluid in the ear, we should have less pressure and therefore more comfort.
Okay. So lastly, what advice would you give parents that are currently considering ear tubes or nervous about it?
Sure. I would say first and foremost, it's super safe. It's a very safe procedure, and if you have a really healthy kid, it's going to go just fine. But if you're unsure, and make sure you talk to people that you know and trust. You can talk to your primary care physician, talk to us, talk to friends, talk to family, because I guarantee you somebody has a kid who has had ear tubes.
Absolutely. Well, thank you so much for your time, Dr. Brown. We really appreciate walking us through everything that's involved with ear tube surgery and giving our audience um, some, much needed information this time of year.
Yeah, you're very welcome. Come see us at Children's if you need anything, and don't be afraid to shout us a holler in the future.